Barbara graduated from the 3-year program at the Hotel Dieu in Bathurst in 1968. After that, she advanced her career by doing her Bachelor of Science through U of M in 1985. After graduation, Barbara went to Ottawa, where she worked for 1 year. Then she returned to Bathurst, where she worked in emergency at Chula Regional Hospital. In her career, she became a nursing leader, a model. She inspired a lot of nurses to continue in their career and also to advance in their career. Over the years, Barbara initiated a lot of programs, such as the organ donation of eyes. She was very instrumental in promoting that, also with poison control, and she revised a lot of the programs, the protocols. She excelled at nursing. Nursing was her love, and she demonstrated leadership, pride, dedication, and excellence in her nursing. She was able to mentor, guide, mold, and influence many nursing careers. She was greatly respected by her nursing staff as well as other nursing people and the medical staff. While she was a nurse manager in the emergency department, she annually identified needs that the emergency department required, including furniture, equipment, and she was beneficial to the patients, the nurses, the doctors. She had 2 great loves in her life, and that was nursing, both as a staff nurse and as a head nurse, and she loved emergency.
That money, it was divided into, there's a $50,000 just for the education for nurses. Every year, there's going to be $2,000 that the nurses can use for their education.
So a donation of this amount, it's a big impact for our clinic, for the equipment, for the education of all the nurses that working in oncology. Cancer is a disease that is currently in the society, and with all the new research for new treatment, new guideline, new equipment, those donations allow us to have the education to give safer and better care for our patient. We can never say enough thank you. Your donation make a big difference in the life of our patient and our work also, because it's allow us to have education and proper equipment to give better care and safer care to our patient. So thank you.
Also, the $250,000 is a lot of money, and we want to buy equipment that will help the nurses and especially help the patients. We're going to buy stretchers with weighing devices included in the stretcher. You can weigh the patient directly. Once the patient is on the stretcher, there's going to be a constant weigh digitally on the stretcher. So that's really a need, and we want to try one, and if we like it and it works well and it's the one we want, we'll buy 5 of them.
Barbara was an emergency nurse her whole career. She started out in emergency in the old Hotel Dieu and remained in the emergency department for many years after, doing different titles in her career. She knew the patients, she knew the doctors. Emergency nursing was her life. She had no immediate family, and so the staff in emergency and her fellow co-workers were her circle of friends.
When she had that profession, she was proud to be a nurse, and everybody in town knew Barbara. They called her Boyle, and she became a nurse manager and treated everybody like family, and everybody was a team. Everybody including doctors, nurses, secretaries, LPNs, housekeeping. Everybody were a team, and she was a great friend. She didn't have kids of her own, and she always considered the emergency like a family. We will make sure that we buy things that she would be proud of and that she would appreciate, and that the patient would get better care with that money.